morning, good afternoon, good evening. Now, I want to introduce you to Harold, a retired teacher who is diabetic, who has been falling frequently sick, and who has had spiked sugars over time, and that caused him a lot of hospitalization. So we helped him to acquire a glucometer to be able to test himself frequently, and offered him support at home to be able to interpret the results. That is what we did in the last 8 months, and that is how Align Care was born. My name is Isaac Kirui, the CEO and the founder of Align Care Services. There are many people like Harold. Globally, in 2021, over 500 million people are estimated to be living with diabetes, and 6.7 million people died. We spend over 9% of our global health expenditure, on diabetes conditions, and most of the time these are complications. The reason for this would actually be the lack of continuous quality care, where patients are unable to test themselves frequently and be able to monitor themselves, understand their condition, and be able to improve their care. But because of the long distances and the high cost, most especially in some regions, most of the regions in Africa, these patients will be frequently falling sick and eventually will die. So in one loop, Align Care is providing services for these patients, an opportunity to acquire a gadget and be able to test themselves at home, relay these results through a digital mobile application, and be able to receive 24-hour consultation services from medical team. We also layer this with the last mile delivery for these patients to be able to access medications at home. So for the patient, there is a process of continuously understanding their health status, and by reducing this cost, time, and distance, we actually can improve the healthcare services for this patient. Align Care, in the last 6 months, have been able to conduct a survey where we identified that there is a need in the market. Over 35% of the patients interviewed were willing to sign up for the product. We have sought for partnerships and received partnerships in 2 clinics where we initially conducted the survey. So we estimate that for us to go into operation, we would need approximately $20,000 US dollars. This is to support us to be able to build operations team, acquire gadgets, and build partnerships. We estimate that in that 6 months, we can be able to earn revenue of up to $35,000 US dollars through the sale of glucometers, sale of test strips and lancets that happens continuously, and also by the patients subscribing to our product and paying a monthly subscription fee. Our strategy to get to the market is to begin with the 2 clinics and try to reach up to 10 clinics in 6 months, where we will have access to up to 1,500 patients. In these clinics, we're looking out for partnerships to be able to reduce congestions for these clinics and make sure that they don't disrupt their revenue. So our offering as Align Care stands out from the other offerings that are already in the market. We have routine care, and also we have small studies like Abbott Vi. So for this routine care, they have a means to be able to log in or to be able to record results on a daily basis and remit these results to the clinicians. They do not have a way in which they can communicate to the patients remotely and be able to charge for that fee. And then also, if you look at it in terms of the patient-centered care of these patients, you realize that actually Align Care will stand out. So put these products together, we are high on sustainability and can be able to deliver better value for these clients. In the last 6 months, we've undergone a process of ideation, an initial market survey. We've built partnerships, and now we are rearing to go in a pilot of up to 6 months. We have a strong team, myself with over 10 years experience in health system, and specifically in chronic disease care. My teammate Edna, who is strong in terms of implementation and partnership building with over 10 years experience, and Kelvin, who is our system developer with experience in building systems. We're asking for $20,000 US dollars to be able to build the initial product, be able to bring the team on board, and a lean team to be able to run operations. And also we're asking for partnership to be able to deliver this dream. Thank you.